Hi, this is Jie Shen from UVA. The title of my project is Associations of Neighborhood Disadvantage and Chronic Stress with Outcomes and Racial Disparities in Breast Cancer. We plan to investigate the associations of neighborhood disadvantage and chronic stress with outcomes and racial disparities among women with breast cancer. We also plan to investigate the potential underlying molecular mechanisms of elastic load biological embedding. Exploration of novel pathways linking social context biology to cancer outcomes is an important way forward to reduce cancer disparities in the field of public health. We will use elastic load as an indicator of chronic stress. Factors that represent the activity of different physiological systems were used to construct AL scores. Area deprivation index (ADL) were used to measure the levels of neighborhood disadvantage and assess local area deprivation. We found that elevated elastic load was associated with worse treatment responses to neoadjuvant chemotherapy and shorter survival among TNBC patients. Elevated elastic load was associated with adverse socio-demographics, unhealthy behaviors, and aggressive breast cancer phenotypes among breast cancer survivors, especially among Black women. We also identified the gene expression profiles and biological pathways associated with AL and race among TNBC patients, which may shed light on the process of AL biological embedding and how elevated AL may promote breast tumorigenesis, contribute to worse outcomes and racial disparities among TNBC patients at the molecular level. We also found that living in disadvantaged neighborhood was associated with more aggressive breast tumor characteristics and probably associated with chronic stress and biological aging. Specifically, we found that higher ADI is consistently associated with more aggressive tumor phenotypes, such as advanced stage, ER-negative status, and triple-negative status. For ER status, the association between higher ADI and ER-negative status was stronger in Blacks. We also found that living in disadvantaged neighborhood was associated with increased odds of having elevated elastic load. Because neighborhood environments are potentially modifiable, future efforts directed towards improving deleterious local environments will be useful to reduce cancer disparities and improve overall health as well. I want to give an example of our study. We investigated the association of elastic load with treatment responses and survival among stage 1 to 3 TNBC patients. Pathologic complete response PCR and overall survival were assessed. We found that AL score was significantly lower in TNBC patients who had better treatment responses and PCR than their counterparts. We also found that a higher AL score was associated with increased odds of having non-PCR and increased hazards of death. Our results suggested that chronic stress may reduce the response to cancer treatment and consequently lead to worse